Hello, my name is Dari Nawaka. I'm the author of Vascular Technology Made Simple. This video tonight is on anatomy of the lower extremity arteries, and this is one of many series of videos that would be on this page regarding the lower extremity arteries. At the end of this presentation, you will be able to understand and identify the anatomy of the lower extremity, risk factors for arterial diseases, signs and symptoms of lower extremity arterial disease, understand arterial pathologies, differentiate between atherosclerotic and non-atherosclerotic diseases. Again, I'm the author of Vascular Technology Made Simple. The recording tonight is extracts from my book, and you can also pick up this book on Amazon.com. Also, I would like to inform you that there's a free webinar scheduled for January 16th at 6 p.m. Registering for the webinar provides you unlimited access to the videos and also a free CME. You can register using the link below to register for the free webinar. You can also purchase my book on Amazon using the link below. The webinars are extracts from the book. Purchasing the book provides you better understanding of the lectures. Now we're going to go ahead and get started. Arterial wall linings. The arterial wall has three linings. You have the tunica intima. The smooth innermost layer consists of single layer of endothelial cell, base membrane, and connective tissue. You have the tunica media. The muscular middle layer provides stiffness, elastic, and strength to the artery. This layer contains mostly smooth muscle, elastic fibers in larger arteries. And you have the tunica externa. The external outer layer, composed of loose connective tissue, contains the vasa viscerum, vessels of vessels, and supply blood to larger arteries as well. Here I have a picture of the lower extremity artery. I have the anatomy starting from the abdominal aorta down to your dorsalis pedis. And you can see here you have your abdominal aorta is further up, which down to your common iliac artery, and your common iliac splits into the internal and the external iliac artery. And as you follow your external iliac artery, you get to your common femoral artery, which then splits to your superficial, now known as your femoral artery, and your profunda or deep femoral artery. At your knee becomes the popliteal artery, and then you have your anterior tibial artery coming off. Then you have your posterior tibial, peroneal, and your dorsalis pedis, your anterior tibial at the base of the foot becomes your dorsalis pedis artery. So here you have the heart. The blood travels from the heart through the thoracic aorta to become the abdominal aorta. In the lower abdomen, the aorta splits into the right and left common iliac artery. And then you go down to your common iliac artery. It splits into the internal, also known as your hypogastric, and your external iliac artery. Looking at your common femoral artery, starts at the termination of the external iliac artery, which then splits into your superficial femoral, also known as your femoral and deep femoral arteries. The femoral artery, known as your SFA, travels down the thigh through the adductus hiatus and becomes the popliteal artery at the knee. Looking at your popliteal artery begins at the end of the femoral artery at the adductus hiatus, gives rise to multiple branches that serves as a collateral to provide flow to the muscle and knee. Popliteal artery also further divides into the anterior tibial and posterior tibial artery. The anterior tibial artery, first branch arising off the distal popliteal artery at the anterior aspect of the ankle joint, becomes the dorsalis pedis artery and travels across the dorsum of the foot towards the base of the great toe. The dorsalis pedis then splits into two branches. You have the first dorsal metatarsal and deep plantar artery. The deep plantar artery unites with the lateral plantar artery, one of the terminal branches of the PTA, to complete the plantar arch. Okay. Posterior tibial artery branches off the popliteal artery, runs down the leg to deliver blood to the posterior compartment of the leg. consists of two major branches, the lateral and medial plantar arteries, which branches below the medial malleolus to supply the foot. The tibio-peroneal trunk begins at the popliteal and bifurcates into the PTA branch and the peroneal arteries after the origin of the anterior tibial artery. And here I have an image here. If you look at it, you can see your posterior tibial artery. As you follow the posterior tibial artery down, and I take a look at it, you see your lateral and your medial plantar artery. So you see your medial right here and your lateral plantar artery. Your anterior tibial artery, if you look at this image, at the top of the foot there becomes your dorsalis pedis artery. And that also splits into your first dorsal metatarsal. So you follow that down and it splits into your first dorsal metatarsal, which is right here, and your deep plantar artery, which is right there. So again, you can take a look at those images and you can actually see the anatomy of the arteries in the. And then you have your peroneal artery, and just remember two letters PP, because your peroneal artery originates from the posterior tibial artery. The peroneal artery is also called the fibular artery, and the peroneal artery travels down the medial side of the fibula to supply the lateral side of the leg. So you have your peroneal artery here, travels down and supplies the lateral part of the leg. Now you have your plantar arch, comprises of the deep plantar artery, a branch of the dorsalis pedis artery, and the lateral plantar arch, a branch of the posterior tibial artery. The plantar and dorsal metatarsal supplies blood to the digits. So I have the microcirculation, which is the circulation of blood to the smaller vessels within the organ. Microcirculation of blood to the smallest vessels within the organs consists of your terminal arterioles, capillaries, and venules draining capillary blood. Terminal branch of an artery is called the arterioles. As shown in this image here, you have your big artery and you have the terminal branch known as your arterioles. Plays an important role in peripheral vascular resistance due to their muscular walls. Provides oxygen and nutrients to cell. Branches out to the capillaries. So you see your big artery, you see your arterioles, branches out right to the mid there, and it becomes your capillaries. Capillaries are the smallest vessel in the body. Thin blood vessels connect the ends of the arteries with the beginning of the venules. From the capillaries, the exchange of carbon dioxide, waste material, and oxygen between blood and tissues occurs. Venules formed when the capillaries come together. It allows for the flow of deoxygenated blood to return from the capillary to larger veins. And the veins then return the flow to the heart. Okay, so here you have your arteries, branches out from your capillaries. The capillaries connects the end of the arterioles to the beginning of the venules, which you can see here, okay, and then goes to the veins, which allow the return of blood to the heart through the IVC, then through your right atrium, which. In conclusion, in this video, we'll learn anatomy of the lower extremity arteries, and you can follow me on the next presentation titled Understanding Arterial Disease. Thank you.